Let's talk about a systematic review and meta-analysis which demonstrates the prognostic effect of ST elevation in lead augmented vector right on coronary artery disease and outcome in acute coronary syndrome patients. Rapid diagnosis of coronary artery disease has an important role in saving patients. The objective of this study was to evaluate if augmented vector right lead ST elevation can predict left main disease, that is LM, and three vessel disease, that is 3VD outcome in acute coronary syndrome patients. In this systematic review and meta-analysis, a total of 45 studies were searched from Scopus, PubMed, Google Scholar, Web of Science, and Cochrane Library. This systematic review included 52,175 participants. In patients with ST elevation, the total odds ratio for LM, 3VD, and LM with or without 3VD were 5.48, 2.21, and 6.21 respectively. ST elevation in lead augmented vector right was linked with in-hospital death and 90-day mortality despite the fact that it could not predict 30-day mortality. The ST greater than 1 mm subgroup had the highest sensitivity for LM, whereas the ST elevation greater than 0.5 mm subgroup had the highest sensitivity for LM with or without 3VD. The appropriate cutoff point with highest specificity for LM with or without 3VD and LM was ST elevation greater than 1.5 mm and ST elevation greater than 0.5 mm respectively. Coming to the conclusion of the study, the odds of LM and LM with or without 3VD were higher than 3VD in ACS patients with ST elevation in lead augmented vector right. Also, ST elevation greater than 0.5 mm was the best cutoff point to screen LM with or without 3VD, whereas for LM diagnosis, ST elevation greater than 1 mm had the highest sensitivity. Furthermore, LM with or without 3VD had a higher overall specificity than LM.